Hi, I'm Allison Phelan-Eagan, and today we have a very special guest, Dr. Jonathan Sack. Dr. Sack is an associate clinical professor of surgery at the David Geffen School of Medicine at UCLA and an attending surgeon at the Ronald Reagan UCLA Medical Center in the section of colorectal surgery. He is also a fellow of the American College of Surgeons and the American Society of Colon and Rectal Surgeons. Now, that is his official title, but to me, he is my beloved surgeon who I respect and I adore. In my phone, I literally have him under Lifesaver because he did save my life. So I thank you for being here, and I'm excited to talk to you.
I'm looking forward to it.
Okay, so let's start with a really big question. What is cancer?
Simply put, cancer is a spectrum of diseases that all have one thing in common. It's the loss of order in cell growth and replication. So with this disordered growth, people get tumors. So tumor and cancer are often thought of synonymously.
So it's kind of like if it was the alphabet, it'd be like A, 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 B, A, 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 and the B is the cancer?
It would be like a mound of cells that are reproducing orderly fashion, and then suddenly somebody gets a wild hair and decides to reproduce more rapidly. And the mound gets larger and larger and more abnormal. So I think what you're saying is the DNA transcription becomes altered. The DNA is the blueprint of our cells that tells them everything they do. If they make a mistake in the transcription of CTAG, which are the letters of the alphabet for DNA, then they lose their growth control. So it is, at its very basic, a DNA mutation from a transcription error that results in disordered growth, uncontrolled growth.
Kind of like an unruly teenager?
For sure, for sure.
Okay, what was it about cancer that attracted you? Why did you decide to go into the field of cancer?
Cancer is part of what I do as a colon and rectal surgeon. It's a big part of it. Colon and rectal cancer is one of the most common cancers, the third most common in males or females, and if you look at it combined, both sexes, the second most common cancer. So my interest in colorectal cancer is because it's a common problem, because often patients require surgical treatment, and it's something that I can do something about.
What is the first cancer? The first most
Number
popular?
one is lung.
Really?
Right.
Huh.
And number two in women is breast, and two in men is prostate.
Right. Are you seeing more cases of certain cancers through the years, like more breast cancer or more colorectal cancer? Are you seeing more of one cancer or another?
So we do track these very carefully to look at epidemiologic trends, and for colon and rectal cancer, the rate overall has been pretty steady.
Okay.
But what interesting little twist is the age of presentation has gotten younger. So we're seeing the same number per year, but it's now skewing to a younger population. Used to be a disease of people in their 60s, 70s, and 80s. Now we're seeing people in their 30s and 40s with colon and rectal cancer.
Do you know why that is?
No, it's quite troubling. Commensurate with that has been a decrease in cancers in the older age group, because we're doing screening colonoscopy at age 50, and then surveillance every 10 years after that.
Right.
And when you detect these precancerous growths, polyps, and remove them, you can decrease the incidence of cancer. So we've helped at the higher age group, but it's been made up by these new cancers in young people. And we don't know if it's genetic or environmental or something we ate. I mean, it's just hard to tell. But it's definitely been proven epidemiologically. We're seeing more cancers in young people.
I think we need to lower the age recommendation to get colonoscopies.
Certainly the threshold for suspicion needs to be lower
Yeah.
in the young age group. It used to be, if you saw a 20 or 30 or 40-year-old with rectal bleeding, you would automatically say, well, that couldn't be a cancer, that has to be hemorrhoids, or it has to be inflammatory bowel disease.
Right.
And I think that needs to change.
Yes.
Young people do get
Yeah.
cancer, and you can't dismiss it as being something innocuous.
Yeah. Well, I was definitely shocked. I was not happy about it either. Why do you think it's so difficult to make changes in the cancer world?
One of it is public perception. It's been very difficult to get compliance or adherence to the recommendations for screening, even starting at age 50. People are more scared of the screening procedure than they are of the disease. So that's a problem. The other problem is educating physicians. And as we mentioned, changing the threshold of suspicion to understand that rectal bleeding, change in bowel habits, and unintentional weight loss always need to be taken as serious warning signs and investigated further, and can't be dismissed as something as simple as hemorrhoids.
Right. I agree. If you had unlimited resources and funding, what would you do with those resources? Where do you think the best place to gear those towards would be?
The big areas would be public education. To improve our compliance right now with screening recommendations is around 60%.
Okay.
It's steadily improved. So every March is Colorectal Cancer Awareness Month. That's
Wear blue.
You got it. So that's helped. And having programs like this to educate people about colorectal cancer, that it is detected early, a curable disease, and so to get people to participate in their health care through preventative measures.
Exactly.
That's one big area. Another big area is to understand the causes of the disease. And we look for environmental exposures, we look for genetic predispositions, so understanding the disease better. And then the third is treatment, is to refine our treatment modalities so that we can cure patients more often.
Do you think that we're doing enough right now? Do you think we're going in the right direction?
There could always be more work done, and so the constraints are finances for cancer research and having the money for educational programs.
Right.
So I think definitely more could be done. And fundraising efforts to that end are a laudable goal. There can be private and public contributions to fundraising
Right.
for colorectal cancer research and education.
I'm doing a lot of that now.
It's a good thing.
A lot of fundraising. Can you explain what the Human Genome Project is? So we can understand what exactly that means?
Sure.
Sounds like a little sci-fi project.
It was in its inception because the technology in the beginning was so difficult and so expensive that to think that you could analyze the entire human DNA code was a lofty goal. And as the project progressed and the technology improved, automation and techniques, it became, and it continues to become, something that we can do with great facility at a much lower cost. So I think the cost of doing an entire genetic mapping for an individual is probably under $1,000 now.
Okay.
And that the turnover time is probably under a month.
Wow.
And at its inception, it was not even conceivable that it could be done because there
Yeah.
are millions and millions of codes. What we still haven't unraveled is what the codes mean. It's translating the letters. We can tell you all the letters, but we can't tell you what each gene codes for. There's a lot of what we call non-functional DNA.
What does that mean?
Which means we don't understand what it does. Why is it there? So that's a big mystery that I think needs to be unraveled. So what is all this DNA doing there that we don't understand?
Wow, it's very interesting. Is there anything else that you think would be of interest to us, or any insider secrets about upcoming cancer cures or anything like that you'd like to share before we come to a conclusion?
I guess there's always another side to the medical approach to cancer that has to be addressed. People looking for cures from snake oil salesmen, and that can interfere with the traditional treatment of cancer.
Right.
We embrace alternative medical treatments as long as they're incorporated as part of the conventional, traditional treatment as well. So I discourage people from looking for these fantastic cures like Laetrile or peach pits or bee venom in lieu of seeking traditional medical care.
Turmeric.
Right.
Somebody told me to take turmeric. I'm like, yeah, okay. That'll solve this problem. So people are going to be wondering or asking, what can I do to not get cancer? There's no real answer for that. But, I mean, some people will say alkaline water, some people say eating, some people say what you're talking about, all these other cures. There's nothing that we can really do. Is there any words of wisdom you can share about that?
Epidemiologically, we look at cancer incidence rates in countries around the world and try to figure out if there are lifestyles or dietary habits that correlate. And the only thing that correlates is the intake of animal fat.
Really?
So in countries we see where there's more primitive eating habits, nuts and berries, really what human beings were supposed to be eating, we see a lower incidence of colorectal cancer. So if I could say one healthy eating habit to avoid colon and rectal cancer is to lower the amount of animal fats in your diet.
You know what? That happened to me naturally. I just don't feel good anymore when I eat animal fat. So my body is actually telling me what I can and cannot eat now and responding.
And you bring up another very important point, and that is not just people who have cancer and how do you diagnose it and treat it, but cancer survivors, because these now are a high-risk group of people that you want to know, how can I prevent the next cancer? What can we do differently in this individual that's already shown a propensity?
Right.
And I think it is some of these lifestyle and diet modifications and these little things like turmeric or these antioxidants, these superfoods. I think they do have an effect. It's not a big effect. Once you have cancer, it's not going to cure cancer.
Right.
But I think these are all important things that we don't understand well enough to advocate that every little thing you do as far as exercise, diet, nutrition can help.
And I'm going to end with one of my favorite things, and that is the topic of being positive. And I don't know if you remember this, but you told me that the reason why I was going to come out on the other side was because I had a reason to live, that I had the ambition to live, that I had the desire to live, the will to live. And you said that makes a huge difference. So can you elaborate a little bit more on that, how your thought and body and mind works together?
It's such an important point that the mind-body connection can't be separated, that your sense of well-being influences your body's immune defenses against cancer. And so when people give up, when people don't have the motivation, their body senses that. And so you conversely can rev yourself up. You can say, I'm going to beat this.
Yeah.
And it makes a difference. I've seen it time after time, and you're a prime example. Somebody who has the will and the desire and the motivation, it makes things happen. It's definitely, you see it in athletes with performance.
Right.
There should be a whole psychology, cancer psychology.
Yeah.
Is how do you beat cancer?
Yeah, I'm working on that.
Oh, it's fantastic.
Whenever I meet somebody, I'm like, you've got to stop the negative thoughts. Like, even now, being post-cancer, you know, you're going for your checkup, and I don't even, like, the minute I think, well, I wonder, I'm like, don't even think it, don't go there, it's not coming back, it's never coming back, it's gone, they cut it out, Dr. Sack cut it out, it's over, and you're going to be healthy, and you're going to help others also live a healthy lifestyle and be positive about it. And I also think that helped me a lot too, and of course your support and the staff and everybody that was there cheering me on. So it's a combination.
It's a life philosophy too. If you live your life with regret and dread, you're not going to have a happy life. So why would you do that to yourself with these precious moments each of us have, and you take one day at a time and you make the best of every day?
Absolutely.
Because none of us knows when the next day will be the last.
Right.
And that attitude eliminates the fear that can suppress all your body's immune defenses. So you are an example of what a great attitude can do to healing, and you're a living example of it.
Well, it's a gift to me. I got cancer and I lived through it, so that's a huge gift, and I'm going to do everything that I can to, give back and be thankful for that wonderful gift. And I thank you so much because you give me my life back. So thanks so much to Dr. Jonathan Sack for speaking with us and sharing his expertise, and we'll be seeing you very soon. Thank you so much.
My pleasure, Allison.